irregular beating of the heart, it sends a shock to the person's heart to alter the heartbeat. So the energy that a defibrillator gives is anywhere from 100 to 360 joules. And the different things that defibrillators treat is supraventricular tachycardia, ventricular fibrillation, atrial fibrillation, and atrial flight. And I'll explain all of these, so don't worry. So tachycardia is when the heart beats over 100 beats per minute. And supraventricular tachycardia is when the heart beats over 250 beats per minute. And this is really fast because a normal heartbeat is anywhere from 60 to 80 beats per minute. Ventricular fibrillation is when the ventricles of the heart don't compress, they just quiver. The picture's a little blurry, but and that's what fibrillate means, to quiver. This is life-threatening, and it'll cause death if it's not treated soon enough. Atrial fibrillation is the same kind of deal except for the atriums. This isn't life-threatening because the atriums don't pump the blood, they just kind of move it to the next chamber. And it can be dangerous if it's left for a long time because it can cause blood clots, which can cause strokes and heart attacks. Atrial flutter is right before atrial fibrillation. It's when the atrium of the heart beats 300 beats per minute and the ventricles just beat at a normal rate. So the atriums beat so fast that eventually they just start to fibrillate. With some heart conditions, the defibrillating charge needs to be delivered at the same time as the heartbeat, so it changes the heartbeat. Those are the conditions that works for. So supraventricular tachycardia, atrial flutter, and atrial fibrillation, and stable cases of ventricular tachycardia. So that just means cases that aren't life-threatening. And the other ones can't be synchronized because there's no stable heartbeat or anything. So the two main types of defibrillators are manual external defibrillators, or MEDs, and automated external defibrillators, AEDs. For manual external defibrillators, these are the pads that are used. You just hook this end up to the machine, and then these are quick combo pads. So it tells you the heart rate and it delivers a shock. And this is for babies. So the normal pads are probably about twice as big as this. So I'll pass these around if you guys want to look at them. So manual external defibrillators are found in hospitals and ambulances, and they treat all cases of arrhythmia. Defibrillators have heart monitors, blood pressure monitors, and oxygen level readers attached. And more modern ones have Bluetooth attached so that they can send information to a defibrillator at a hospital. So in case the ambulance is in a rush and it's a life-threatening situation, it'll just cut down on the time it takes. And these can synchronize. The shocks that defibrillators send are either biphasic or monophasic. What monophasic means is it sends one big powerful shock to the heart, and this has been proved to cause burns and internal damage. So recently doctors and paramedics have switched to biphasic, which means it's two smaller shocks that are about 10 milliseconds apart, and that is less damaging and about 30% more effective. Manual internal defibrillators are virtually identical to the external version, except the charge delivered through paddles that are attached directly to the heart. So these are used in operating theaters and in open heart surgery. Implantable cardioverter defibrillators are implantable devices that constantly monitor the patient's heart rate and it will just shock if it's necessary. So these are given to people who have bad hearts and are most of the time it's older people. This device can tell the difference between fibrillation and tachycardia and can treat it accordingly. Wearable cardiac defibrillators are external defibrillators that are worn like vests. This unit will automatically deliver a biphasic shock if it's necessary. These devices are usually given to people who are awaiting implantable defibrillators or people who don't want to have surgery. Automated external defibrillators are smaller units that are easy to use and they're programmed so that anyone off the street can use them. They're found in public places and they're usually brightly colored. And the disadvantage of using these is that it takes about 10 to 20 seconds for the machine to decide if a shock is necessary, where a normal doctor or paramedic could decide if it's necessary and treat it in a lot less time. These defibrillators treat only ventricular fibrillation and ventricular tachycardia. So when someone is found unresponsive, with no pulse and not breathing, an AED should be used as soon as possible. They're really easy to use. Pretty much all you do is turn it on, and it'll tell you to attach the pads, and then you wait a couple of seconds, and it'll tell you if you need a shock or the patient's okay. So that's it.